I'm Dr. Jacquelynn Saravane. I'm a pelvic physical therapist at Washington Regional Outpatient Therapy Services. So pelvic therapy is a specialty area of physical therapy. We treat muscles, joints, nerves, just like physical therapy most people are familiar with. Those muscles, joints, and nerves just happen to be located in or around the pelvis. So we treat basically everyone with a pelvis, men, women, children, basically all age ranges. So we often treat pelvic urinary urgency, so basically feeling like you gotta go all the time, having to go all of a sudden really badly, or having a little bit of leakage, whether it's a few drops or a lot. And then we also treat constipation or difficulty with having bowel movements. So basically, if we're not emptying well or regularly, then we get this increase in pressure in our abdomen, and increasing pressure in our abdomen can affect more than just the bowel. So it affects our bladder. You can have more leakage, more urgency just from that pressure. You can have pain in your abdomen and also pain in your lower back. A decent number of people with lower back pain also have constipation. When we're talking about constipation, a piece of that puzzle is straining and straining frequently to have the bowel movement. So when we're straining, we're putting pressure down, and that pressure can lead to further things like hemorrhoids, anal fissures or tearing, which is not fun, and then pelvic organ prolapse, especially if that continues a lot over time. So we want to kind of get in and address things early so that we can prevent those worsening symptoms later. Water, fiber, exercise, and all those things are great because they work, and that's true. But in addition to that, posture, so how we sit on the toilet matters. If you sit, you have your feet elevated up on a stool or a box or anything that gets your knees higher than your hips, that helps open things up. Taking nice deep belly breaths and relaxing the muscles helps open things up and helps make it easier. And in addition to that, kind of getting your bowels on a routine. So getting a schedule. They're creatures of habit. They like to have things coming at the right time. To learn more, visit wregional.com/pelvic therapy.